Grasp the chest tube in the jaws of a large hemostat for a dog or mosquito hemostats for cats. Trim the excess tube with a blade to create a point. Leave the hemostats attached. Have an assistant grasp the skin just behind the shoulder and pull the skin forward 1 to 1 1/2 inches. Incise through the skin and intercostal muscles at the level of the 7th or 8th intercostal space using a number 11 scalpel blade. The incision should be just anterior to the rib to avoid the intercostal vessels that are located just behind the rib. Force the hemostat containing the chest tube through the remaining muscle and pleura. A pop will be heard as the pleura is penetrated. Open the jaws of the hemostat and feed the chest tube toward the anterior sternum. Connect suction immediately to the suction adapter on the terminal end of the chest tube. If necessary, rotate the tube so that the section of the tube penetrating the chest is covered by the anterior leaf of the round silicone skirt. Stitch the skirt in place using 5 or 6 tough sutures. Grasp approximately 1/4 inch of skirt and 1/4 inch of skin with each suture. Complete securing the tube to the patient by stitching the silicone strip on the caudal end of the tube to the skin. If thoracic lavage is necessary, remove the suction adapter and cap the caudal portion of the tube. The black valve on the side port of the tube is a syringe-activated valve. Place the syringe into the lower depth of the valve and flush. Valve will close when the syringe is removed. Note the path that injected fluid takes. Flush can be used to free clots in the tube, or by removing the cap on the end of the tube, flush can be used to clear clots and debris from the chamber. Note that there are 2 one-way valves in the pump chamber. Squeezing this chamber will expel air or fluid. The 2 one-way valves are a built-in safety factor. However, they are not sensitive enough to allow passive drainage of a pneumothorax. Pneumothorax requires intermittent drainage using a syringe or suction. A tension pneumothorax must remain under constant suction. When the chamber remains collapsed after squeezing, all air or fluid around the tube has been removed. drain effusion such as chylothorax or pylothorax, place a sterile IV line attached to an empty IV bag into the lure adapter on the terminal end of the tube. Place the bag below the level of the patient. Squeeze the chamber a few times until fluid begins to run down the IV tube. This will form a siphon action which will continue to keep the fluid drained from the pleural cavity. Air should always be drained by suction or by a syringe. In conditions such as pylothorax, solid exudate may block the entrance to the IV line at the lure connector. If resistance is met when the pump chamber is squeezed, remove the IV line to clear the blockage at the lure connector. The PleuraCath chest tube is provided sterile. Please note that steam sterilization will damage the valves and damage the integrity of the tube.